Hey friends, it's Brian, also known as KindaSpoony, and I'm so glad to be back with you today. I've got an exciting update about my EDS journey, including details about my most recent surgery and a sneak peek at what's next. On December 26th, I had my 7th surgery, this time on my left ankle, and here's what the procedure involved. Arthroscopy with synovectomy and debridement of interior bone spurs. This part involved cleaning out inflamed tissue and removing bone spurs that were limiting my range of motion. Open tenosynovectomy of the peroneal tendon. This addressed chronic inflammation in the tendon sheath, which was causing pain and weakness. A Brostrom ankle ligament repair and calcaneal ligament repair. These repairs were crucial to stabilize my ankle after years of wear and tear in the Marine Corps. Surgery was performed by Dr. Matthew Oseto at the Erickson Hand and Nerve Center, and his attention to detail and skillful approach made this complex procedure as precise as possible. To break it down a bit more, the Brostrom repair is a technique used to reconstruct and tighten the ligaments in the ankle. It's common for patients like me with EDS, where loose or damaged ligaments are a constant challenge. Together, these procedures are designed to improve my ankle strength and prevent further injuries. The arthroscopy and debridement were like giving my ankle a deep clean. It's amazing how removing a small bone spur can make such a big difference. Warning though, it hurts. I can't show you the results just yet since the bandages are still in place, but in my next video we'll take a closer look at the incision sites. I'm also hoping to include a few words from Dr. Oseto himself, so stay tuned for that. Looking ahead, my focus is on recovery and preparation for what's next. That includes plenty of physical therapy, pool therapy, and continuing to rehab my shoulders. In 2025, I'll also be tackling bilateral hip surgery to address some cam lesions. It's been almost 3 years since I was diagnosed with EDS. 7 surgeries later, I'm still here, moving forward, and determined to make the best of what I've got. Thank you so much for your support. It means the world to me. Be sure to like, comment, and follow so you don't miss part 2 of this update. Take care of yourselves and each other, and I'll see you soon. Bye for now.
So this is the inside of your ankle. Unfortunately, our white balance was off, so everything looks kind of rosy red.
Nice.
This is the talus, or the bottom half of the ankle, and this is the tibia, or the top half. And you just had some bone spurs there that we cleaned up a little bit and shaved back so that when you bring your ankle up, or bring your foot up in what we call dorsiflexion, you wouldn't pinch anything. I think
so that's the kind of dull ache that I can feel right there?
That's the dull ache you can feel right there. I think the cartilage in this ankle looked better than the cartilage on the other one. The other one you had some cracks and fissuring and for lack of a better term, potholes in the surface. This one you didn't have that.
Good.
So just a little tidy up for the scope, and so not a lot to do there. And then on the ankle itself, your ligaments were stretched out, but in good enough shape that we could tighten them up. Brace is basically like a Kevlar backup to help support. It's almost the exact same thing we did on the other side.
Yep.
So
let's see it.
Yeah. And you did have what I would call low-lying muscle on the tendons again. I think you have that on the other side as well.
Yep, and that's where the Achilles tendon, like running into the foot.
It's on the outside half, and so that's where the peroneal tendons, the tendons that bring your foot to the outside, basically resist rolling. Yeah, exactly. Pushing this way. That one. Those that resist that. You had muscle that attached to the tendon that just kept going down, and then that muscle is getting pulled into the little tunnel where the tendons glide behind that ankle bone.
I know exactly what you're talking about.
And so it's getting overstuffed. And it's a small amount of muscle that we just remove it from the tendon. You won't miss it. It's not really doing anything other than just getting bound up. But if it is, great.
Yeah. Yeah. All right. I'm excited. Let's see it. As far as healing goes, coming out of anesthesia went very well this time.
Great.
I think we'll definitely try to mimic that in the future procedures.
So they're getting it dialed in.
Yeah. Yeah, really. I mean, we kind of...
Because the anesthesiologist will look at the recipe, if you want to think it like that. They'll look at the recipe that you had before. And if you say, oh, I had nausea, or oh, I had, whatever, they'll try to figure out what it is and avoid it.
Yeah. And I'm really good about giving them feedback, too. Well, it makes a difference because, you know, the right ankle, I did not have as good an experience with anesthesia, and I didn't sleep until about 5 days into surgery.
That's not good.
Yeah. This time I was able to sleep the first 2 nights, and then like
That's huge.
around Sunday, wasn't able to sleep, just pain, couldn't get comfortable, and I added a hip brace. Yeah, I see what you're saying.
Yeah, so
Because
this
I
should
thought
be
that
smooth.
looked like it does look like kind of torn, whereas
That's the smooth on that one. This is the
my
rough,
goodness.
so you can see the difference, even though it's orange.
yeah, that's crazy.
Yeah, these are much better and easier. But when I told you you could go ahead and open it up, it'd be something like that.
Yeah,
But
and
it looks like you didn't have to.
no, I was I think maybe if it had been one more night, the ace bandage would have fallen off completely, and I would have had to.
But this is a nice. I like this dressing because it's pretty well tolerated as far as swelling and.
Yeah, I didn't have any like problems with pressure or swelling.
Nope.
And it felt really good in a neutral position too, you know, so I was able
Yep.
to like rest.
And that we have to be careful with. So we don't want your foot to go this way to turn in because you're going to stretch everything. There's some people that will, put you in a cast. I don't know if you have a walking boot or not.
Yeah, we brought it.
But that would be perfect. That looks really good. I remember last time you were a little bit waterlogged.
Oh yeah,
Because I think it was it summer?
I think so. Yeah,
Was it or not? I don't know.
it was March.
March. All right. Well, maybe it's hot over there. Then who knows? But that looks really good. We will need to get those stitches out at some point. The redness, I'm not worried about.
When do you think the stitches will be ready to pull?
2 weeks.
Okay. Well,
3 if you can.
We'll try to go 3, which is what I think we did last time, and I'll call you.
Yep.